removable partial denture, metal trying and teeth trying. So we review how to fabricate or design metal framework. And these are the metal that is printed, and we receive the metal framework from the laboratory. Now, this next appointment with the patient is delivering metal framework. We need to try in the metal framework fitting because before we adding onto the denture teeth, so to make sure that your framework are fitted correctly in regarding the accuracy and also the occlusion check. At the beginning, we scan the intraorally, we design metal framework. Metal framework is 3D printed, and then this model also 3D printed. So we could use this model and the framework for the setting the denture teeth on top of it. So before we setting the teeth, we need to check intraorally to make sure this one are fit. When you're doing the metal framework trying, the first thing you need to follow is see whether it's a fully seating. And by looking at the occlusion rest, that's how you check whether the framework is fully seated intraorally. The framework, when it's not going to seat, then you use the rules and the chloroform to adjust primarily guiding plane area and minor connector until the framework fully seated. And the checking with the seating, as you notice, that is check on the rest seat and press enough pressure to make sure the framework is stable, is not mobile. After you checking the metal framework seating, then you always must check the occlusion. When you check the occlusion with the metal framework, this is the rule. Make sure you watch the existing teeth, natural teeth contact area, and with the framework without the existing teeth contact should not be altered or changed. Meaning when the teeth and this area having mylar holding, then with the metal framework in, still that mylar holding teeth contact should be maintained. So you are checking with the mylar, make sure the teeth holding the mylar, continue hold the mylar with metal framework in. That's confirmed the occlusion was not changed due to the metal framework. In case that you notice that the teeth are open, so the mylar doesn't hold, then area that you need to watch is usually the metal occlusal rest or any single rest that may have a contact with opposing and need a further adjustment to establish occlusion back to where patient had. So as you notice, the framework fit very well, meaning the printed framework correctly manufactured. But watch carefully. Now, when I try to articulate opposing dentition, which is mandibular, watch carefully about number 6 lingual, which has a single rest, which does have direct contact with opposing dentition. And that means that when this framework made, the single rest position are already past the opposing contact area. So as you notice this red mark, that's the area that has opposing teeth contact. So the metal framework of single rest should be lower than the contact point. Pictured after we adjust the single rest contact, so the patient be able to close as original occlusion. Only exception is when you intentionally change the vertical dimension, then that is a different condition. But when you do not have changing vertical dimension with the partial denture, the occlusion should be checked as described. After you check the metal framework try-in, now is the time to mounting your cast with the metal framework. To mounting that one, you need to make a record base on the metal framework. And this picture shows acrylic record base was made on top of the framework to facilitate the better contact between the tissue, because this settled area of the metal mesh do not have direct contact with the underneath the tissue. Therefore, to make a better contact with the tissue, that's the first objective. And second, to supporting the partial wax rim which will place on top of this record base for the bite registration. When you fabricate the record base on metal framework, you need a good contact with the tissue underneath, but it's not necessary to extend full vestibule. So as you notice, the full vestibule was not engaged on the distal portion because that's not necessary to cover all of it. Full extension will be covered during the final processing. So after mounting, then the teeth will be set, and this is the picture. The denture teeth setup on the metal framework still has not been processed the denture yet. We call partial denture teeth try-in. The reason we're looking at the teeth try-in before we process, so that we could manage the arrangement of the teeth, we could confirm the aesthetic, and also we verify occlusion. So by delivering teeth setup intraorally with the patient, and you could verify the occlusion, make sure the occlusion is correct, that means our mounting was accurate. If the teeth setup occlusion are different as you've seen in the model, that means mounting has a problem, which means remounting is necessary. When it's needed, protrusive record also taken after teeth try-in. And make sure you get the patient approval at this appointment, because once after process the denture, there's no chance to change any teeth shape or position. Now, also the teeth try-in appointment, the good base contact on the tissue are needed, but not complete extension of the denture base with the wax on this side. Teeth try-in appointment. You observe the setup in the articulator. Again, this is a teeth with the wax on top of the metal framework. And check the fit, which shouldn't be difficult because we already checked the metal framework check before this appointment. So the fitting shouldn't be an issue. Now it's fully seated. And then we check the occlusion so that we verify our mounting. We're watching, make sure the teeth contact are same as you observe in the articulator. So make sure our mounting accurately. And then the denture will be processed in the laboratory, and the following appointment, which will be the RPD, removable partial denture delivery. And delivery appointment, we'll discuss about the complete denture delivery in the next session, but insertion of the RPD, partial denture delivery, are slightly different. The partial denture delivery, number one, the sharp edges of the resin, which is after process, quite commonly right adjacent to the natural teeth, meaning next to acrylic, next to abutment. So one in here on this side, and this side. Those acrylics should be smoothed out and make sure it's not interfering with insertion, especially in the guiding plane. The complete denture often slide over undercut, but partial denture with the metal framework will not pass through the undercut. And undercut most often seen in the maxillary buccal tuberosity flange area or mandibular on the distal lingual flange area are common area that you may have an undercut. For full denture, the lengths of the flange are carefully developed and hopefully maintained for the border sealing. But border seal is not essential for RPD, partial denture, as retention is mainly derived from direct retainer, which is clasp assembly. Therefore, the undercut that interfere with insertion are reduced and or the flange are shortened. So that's the difference between the complete denture versus the partial denture. And in a situation where the guiding plane are mostly resin, make sure no undercut are present. In partial denture, this is a common picture with the metal framework and the resin base on the edentulous area. But in certain situation, you may plan for base with entirely made out of metal. So this particular case, replacing tooth number 19, which is mandible, but due to the opposing teeth are super extruded. And of course, you may treat the maxillary extruded teeth with endodontic treatment and crown, but in case that we do not plan for anything due to the natural intact tooth, then the lower has very limited space for the teeth. If the spaces are not bigger than 4 mm, which is 2 mm for the metal, 2 mm for dental teeth, then anything less than 4 mm space, you may consider making the metal base partial so that the teeth also in the metal structure. Metal base has advantage. It has a naturally cleanness of the material itself. It's a better temperature interchange between the tissue, and it's primarily minimum interocclusal space case. Then you don't have a choice other than making metal base, because acrylic and the metal cannot fit into this very minimum space. But there's a disadvantage. Number one, the post-insertion adjustment are much harder than acrylic. And because the nature of this base are made out of metal, the reline or the rebase in the future are not possible. And because of this reline process not been possible on the metal base, the functional impression technique are needed, meaning before you fabricate the metal, the base tissue side registration has to be accurately registered so that you do not need to minimize the inaccurate contact with the base side, because due to the inability of relining process. In regarding the partial denture treatment plan, there's a few things that you need to consider during the treatment plan phase. Number one is whether we're keeping the premolar or molar in partial denture. Well, keeping these molar teeth, premolar and molar, Even one additional molar will increase significantly about the partial denture stability. So for example, this picture, whether we have this last molar teeth compared to you don't have molar teeth, the stability of this entire partial denture are completely different. Therefore, the advantage of keeping premolar or molar are increased stability. But of course, there's disadvantage because to keeping the tooth quite often require endodontic treatment and the crown after. Therefore, the increased cost are main disadvantage. Why is it so important having keeping the molar? Because that will determine the candidate classification of the partial denture. Remember, candidate class 1 and 2 has a distal extension, and candidate class 3 and 4 are teeth-borne partial denture. The teeth-borne partial rest can be placed in any position, meaning either medial or distal, as long as they direct occlusal force along the long axis of the abutment tooth. This teeth-borne partial, which has meaning the posterior teeth present, most of the support come from the abutment because it has abutment in the anterior, posterior abutment present. Stability, bracing, support should be maximized due to the existing posterior teeth. So the tooth-borne partial are good stability compared to distal extension-based partial denture. This is example candidate class 1 bilateral distal extension. And anytime that you don't have any posterior teeth missing, the rest position on abutment teeth are crucial. The support actually share between the edentulous denture bearing area, which is tissue, and the abutment. So this distal extension based partial denture support come from the tissue and the abutment teeth, meaning residual ridges and occlusal rest. Therefore, the design should provide a stress control, meaning when you designing distal extension base side abutment clasp, the direct retainer design has to be carefully designed, meaning you need to consider one of the 3 stress releasing clasp design used, which we discuss RPI, RPA, or combination clasp will be indicated for these most distal abutment teeth. And because of nature of this distal base are moving up and down quite more than teeth-borne partial, remember that putting the rest seat on the medial side are critical in this condition. So we just reviewed the difference between tooth-borne partial versus extension-based partial denture. Make sure you understand the difference between these two types, because when you design, it affects the design as we discussed. Support are different, therefore the rest position also different, and clasp design also. So we discussed about the metal framework trying, the teeth trying, and the difference in the treatment planning for partial denture.